Hey, Brandon.
Hey Dave, what's
How are
up? How you
you?
doing?
I can't hear you.
You can't hear me?
Oh, you're low, but I hear you now.
Okay, let me talk real loud for you.
No, it was my phone.
Oh, is it? Oh, okay. As long as everyone else can hear me, that's good.
It was my phone. I need to turn up the volume.
I also feel like Instagram changes the rules. Like I know Orlando tried to go live with like a filter once. When you use the filter, turns off your volume. So I wasn't sure like, you know, there are these little tips and tricks you got to do. But turning up the volume is another tip and trick.
Definitely. All right, so I am David Wilson. I am a Whitman-Walker influencer, but I'm part of the community health team. My pronouns are he, him, his. And Brendan, I'll let you introduce yourself.
Hey, my name is Brendan. I am an employee of Whitman-Walker. I am the social media outreach HIV prevention coordinator. My pronouns are he, him. Really excited to be here. Thanks for having me, Dave.
Thank you. I'm happy that you're here. So today we're gonna be talking about why it's important to get tested for HIV. COVID-19 has made it way more difficult to do pretty much anything. That also includes getting tested for HIV and STIs. Today, obviously, I'm talking to Brandon, but Brandon is a member of our community health team at Whitman-Walker Health. And he's going to talk about how we can stay on top of our sexual health, especially during this pandemic. Yeah.
Right on. Ready to talk.
It is a lot of people joining. So as you all join, I do want you all to know that feel free that you can drop questions or comments into the comment field and press send, and we will address them live and on camera here with you all. So feel free if you have any questions to put them there. So my first question for Brandon is, during the pandemic, what can I actively do to help prevent against, getting HIV or STIs?
So you have a few options. One that's really safe for the pandemic is to choose not to have sex. For a
All
lot of
right.
people, not a realistic option. Pandemic's been going on over a year, and we recognize that that's just not an option for some people. So there are a few more ways, maybe more realistic for people. One is using condoms correctly. So whether you use an insertive condom, a receptive condom, they're really effective when used correctly. And no, I keep saying when used correctly, make sure that you're using lube with condoms so that they don't break. You're checking the expiration date, that you're not using more than one condom, that you're not keeping them in like a
Yeah.
hot where they could get damaged, all that jazz. So you also can have a long-term mutually monogamous relationship with a partner who's been tested and tested negative for HIV and other STIs, or is at least undetectable for HIV, because undetectable, you can't spread it to other people. To specifically prevent against HIV, you can take PrEP. PrEP, or pre-exposure prophylaxis, as I'm sure a bunch of you guys know, is like a birth control for HIV. So if you take this pill once a day, it has a 99% efficacy rate at preventing against acquiring HIV through sex, which is really incredible. It usually doesn't come with many side effects either. It's pretty easy to get to. You can get them at Whitman-Walker. Call that number in the comment section. We can get you set up. You take PrEP before you become exposed to HIV. If, let's say, you get exposed to HIV and you need some sort of emergency contraception, you can take PEP, also called post-exposure prophylaxis.
Right.
It's like a plan B or morning after pill as opposed to the birth control. So it's got to be within that first 72 hours of your exposure. But it's also pretty effective at making sure that even if you were exposed within that 72 hours, you won't acquire HIV.
Right.
So PrEP and PEP only for HIV. You got to do other stuff to prevent against STIs. On top of all that, you got to make sure that you are talking with your partners about your own status and also about prevention methods that you guys want to use. Make sure you all are getting tested so that you have a really accurate understanding of your and your partner's statuses.
Great. Yeah. So, I mean, we both obviously work in community health, and like there's always this narrative of, get tested, get tested, get tested. But why? Why should we get tested?
So getting tested is important because I think a lot of people think of STIs. It's like, I have an STI if I have like burning when I urinate, if I have some like discharge down there, if
Mm-hmm.
there's any discomfort. So many STIs are asymptomatic, meaning that you can get infected, but you won't show any symptoms. So the three most commonly reported STIs in the US, chlamydia, gonorrhea, and syphilis, are usually asymptomatic. So you might experience those symptoms that I talked about, like irritation, discharge, discomfort. But most of the time, you won't really know that you have the infection, or at least you won't know for a while. And HIV can stay asymptomatic for many years, up to 10 years,
Mm-hmm.
before you actually start having symptoms that would make you realize that you might have HIV.
Right.
So in the meantime, while you don't know that you have these infections because they're asymptomatic, you can be spreading them to other people unknowingly, and they can be hurting your own body. So you get tested because even if you don't think you have it, you might, and you're
Mm-hmm.
protecting your own health and you're protecting all your partner's health.
Yeah. Well, I mean, thanks for giving us the reason why we should get tested. Like I said, we're always telling people, you should get tested, but like for those that may not be familiar, what actually happens in a testing appointment?
Testing appointment is really easy and simple. Like, it's not a huge deal. Tester will ask you a few questions about your sexual history, kind of like answer any questions you might have, get a gauge of kind of why you're in, how they can help you. And then at Whitman-Walker, when you come in to get tested, starts with an instant test for HIV. The instant test is really cool because it's instantaneous. You get your
Mm-hmm.
results back in 60 seconds. That's amazing. It's really good to know. The test for HIV, that instant test, just a finger prick. So really easy. And next, you go to a phlebotomist, someone who's going to draw your blood. And that blood draw is going to test for syphilis. And then you go into the bathroom by yourself and you do your own swabs in your throat and your rectum. And then you do a urine sample. And then you bring back those samples and you head on out. The whole thing takes anywhere from 15 to 30 minutes, depending upon how many questions you have. It's really simple and easy.
Yeah. So I actually want to add to that, Brandon, because I've obviously gone through that many a times getting tested at Whitman-Walker.
Yeah.
That is a specific process that Whitman-Walker has in place. You're not going to get that same treatment everywhere. I can attest
Right.
to that. And so it actually makes it, a lot easier because you're getting the samples yourself on your own body. And so for those of you who may have concerns about that, I think this is a perfect place for you to go get tested. Whitman-Walker is a great place for that. And which also brings me to my next question of, confidentiality. So how confidential is the information and the test results and all that stuff?
1000% confidential. So I think we know that this information is really sensitive. There are a lot of stigma, taboo around sexual health. As with all health information, but especially this health information, anything you tell us is going to be bound by law, by what's called HIPAA.
Mm-hmm.
It's your patient private health information, 100% confidential. You do not need to worry about anyone else knowing about your status, about any of your medical decisions except for you.
Right. Great. I also want to remind the viewers, if they have questions, drop them in the comments. So, say that I show up to an appointment for HIV STI testing. How much is that going to cost me?
Nothing.
That's good.
Really? Yeah, and I think, as I said, it's not like that everywhere. Some places you have to go and they'll charge you for the labs, especially. They'll charge you for a doctor's visit.
Mm-hmm.
We are totally free. You don't even need to bring an insurance card. We don't care about that when we sign you up. Totally free tests. Walk in, walk out, no cost.
Good. And as far as like location wise, where do I go? How do I get there?
Yeah, Whitman-Walker Health has 2 locations where we're doing HIV and STI testing. So they're spread in different places in the city. So one might be more convenient to you. One is in Logan Circle area in Northwest DC on 14th Street, like 14th and R. And then we have another location in Southeast DC across the river, right in Anacostia. It's called our Max Robinson Center, right on Martin Luther King Jr. Ave. So 2 locations, you call us, we'll sign you up for whichever one you want.
Mm-hmm. Cool. Now, do you all accept like walk-ins, or do I have to make an appointment? What's that like?
So I think before the pandemic, we loved walk-ins. Like, we pride ourselves on going right to you, on being really accessible. Because of the COVID-19 pandemic and the restrictions that are going to keep all of our patients and employees safe, we're not doing walk-ins at this time. Hopefully that's going to change soon. Like, I hope COVID goes away and like we can lower our restrictions. But until that happens, you got to call the number that's in the chat, and you can make an appointment. Appointments are really easy. Like, if you call, I guarantee I can get you the time that you want. It's really, really easy to come in. So yeah, just make that appointment with the phone number below.
Yeah, so that's how you make an appointment. So if you need to, that number is 202-797. We've also pinned the number there. So, just call and say that if you want that you're looking for an appointment, and we will be so happy to assist with that. And it's like Brendan said, it's really easy. Is there anything else you want to share with us about HIV, STI testing, or anything else?
Let me think. Yeah, I'm answering the phone. Also, we have a bunch of people answering the phones to help you. If you might not speak English, we have Spanish-speaking employees who are happy to answer the phone. Every day when we have testing, we always have a Spanish-speaking tester, and we have a language line. If you speak a totally different language, we're going to meet you where you are. We're going to assist you no matter what. And yeah, right. When you go in for testing, we also offer condoms and lube, totally free. Like so yeah, those are some perks of coming in to get tested.
Yeah, I usually bring props to these.
I think that's everything from my end.
I proof that you can get these things. But no, thanks, Brandon. I appreciate you coming on and sharing all your knowledge. Again, if you all are seeking HIV STI testing, I definitely encourage you to do that. And give us a call at 202-797-4439. I also want to remind everybody that it is still important to keep in mind about the pandemic, COVID-19, and how we can prevent the transmission. So all of the information I've shared previously, but we'll say again that it's extremely important to remain socially distant. That includes being 6 feet apart, away from anybody else. That also includes wearing a mask in public, avoiding large crowds. I know a lot of people have been sending me videos about what's going on in Miami. That's crazy. Don't do that. But also, if you can work from home. I know a lot of people are starting to have conversations about how to come back into the office. But if you can work from home, continue to do that. Also, continue to speak with your loved ones via FaceTime, Zoom. The CDC did roll out some new recommendations for fully vaccinated people. So I definitely encourage you all to get vaccinated, but also go and view those requirements, because if you are fully vaccinated, it's okay to view your loved ones. They have some recommendations about how to do that on the website. So definitely encourage that. Social distancing is a way to care for your community. But again, stay up to date on local, national guidelines for testing, vaccinations, quarantine, all of that. Again, I always encourage to visit the CDC website for the most up-to-date information about national requirements or suggestions or recommendations. And last but not least, wash your hands for 20 seconds and wash your sex toys for 20 seconds after and before use every time. Thank you all for tuning in. Remember that you can follow us on Twitter as well as Facebook. That's at Whitman-Walker. Also at Real Talk DC _ on all platforms, Instagram, Twitter, and Facebook, to stay up to date on everything Whitman-Walker Health. I am happy to have had everybody, and thanks, Brandon, for being here. I appreciate you. Till next time.
Thanks, Dave. Have a nice night.
All right, bye-bye.